Assalamu alaikum wa rahmatullah. I am Dr. Ahmed D. Abdulwahab. I am a diagnostic and interventional radiologist in Erbil, Iraq. Today we will present an interesting case, although it's pretty much straightforward, I think, in my opinion, of a female patient. She's 93 years old. 93 years old female patient presenting with vaginal bleeding for a pelvis MRI. 93-year-old female, vaginal bleeding, pelvis MRI. So first of all, let's start with this image. That's a coronal T2 weighted image. You know it's T2 because the urine in the urinary bladder is bright, and we can see here that there is some sort of a mass here. We will have more details about it in a few minutes. Okay, so there is a mass here. And let's go to the axial T2 weighted fat saturated images. You can see the urine is bright, so it's T2, and you can see the fat in the subcutaneous tissues is dark, so it is a T2 fat saturated images. And you can see that this is the mass that we are talking about. Here there is a kind of a mass, and you can see the uterus here. In any case of pelvic MRI for gynecological causes, the sagittal images are of very big importance. So let's go to this T2 weighted sagittal images. You can see that this is the mass that we talked about, and it's compressing on the urinary bladder here, and you can see the uterus, which looks normal sized for a normal aged patient, for a young age patient. However, for a 93 years old female patient, this is a bulky uterus. It should be much smaller than that. And you can see, surprisingly, that this endometrium is prominent. In 93 years old patient, the endometrium should be very thin, like 1, maybe 2 millimeter, no more. And the more interesting thing is you can see this is the junctional zone here, and here it is interrupted. The junctional zone here is not seen, it's interrupted. So what does that mean? Even anteriorly, it's a little bit interrupted. Okay, let's go to the sagittal T2 weighted fat saturated images. You can see that this is the fibroid that we are talking about, and you can see this is the endometrium that is so prominent, and you can see the junctional zone, which should appear as a hypointense line. The continuous, it's interrupted anteriorly and posteriorly. So let's give some contrast and see first of all what's that. This is the coronal T2 weighted fat saturated images. We can see the same effect. You can see the junctional zone here on this side is interrupted, and you can see that this is the mass that we are talking about. So let's give some contrast, see what happens. This is the axial T1 weighted images, and you can see that this mass is showing kind of mild post-contrast enhancement, and you can see that the endometrium is prominent, and there is something bulging into the endometrial cavity that is showing post-contrast enhancement here. And let's see, do we have a T1? Yeah, we have a T1 post-contrast images. Also, you can very obviously see that the junctional zone is interrupted here and there, and that the endometrium contains something that is enhancing, and this mass is not showing a significant post-contrast enhancement. And let's see, do I have we have the T1 weighted images. You can see that this endometrial lining is showing significant post-contrast enhancement. So what do you think, in your opinion, is the diagnosis in this case? I will see you tomorrow with the answer. Thank you very much.